There's a certain set of people who have a harder time with the coronavirus, and it has to do with their hearts. Dr. Maria Simbra has a look at the new research.
What if there were a way to predict who will have a harder time with a coronavirus infection? Researchers may be onto a clue in the heart.
These patients seem to do worse, the ones that we've detected right ventricular enlargement in.
In a one-month study of 105 COVID patients at one hospital in New York City, researchers compiled a number of characteristics.
They looked at not just the patient's age and their demographic findings, things like diabetes and high blood pressure, but they also looked at laboratory testing values, imaging values, whether the patients were on ventilators.
The statistical analysis showed patients were more likely to die if they were on a breathing machine, needed drugs to help blood circulate, and a surprise factor, a bigger than normal heart chamber.
The right ventricular enlargement, however, is a finding that hasn't been very well documented previously. I think it's a relatively new finding.
In the study, about a third of the patients had this. Of these patients, 4 out of 10 died, compared to only 1 out of 10 if they did not have the finding. It's easily seen on a heart ultrasound.
Something that they could do quickly at the bedside when they're seeing these patients.
The right ventricle is one of the pumping chambers of the heart. It pumps blood that comes back from the body into the lungs to pick up oxygen. It can enlarge with COVID because of inflammation in the lungs, small blood clots in the lungs, or a viral inflammation of the heart itself. Patients with right ventricular enlargement might be monitored more closely or get medicines to dilate blood vessels in the lungs. Whether all COVID patients should get a heart ultrasound remains to be seen. A full echocardiogram requires the patient to go to the lab and PPE for the staff. But
I think doing a limited portable ultrasound on these patients is a very reasonable thing to do.
a topic for future research. I'm Dr. Maria Simbra, KDKA News.